My name is Megan Brown, and I'm going to do my head-to-toe assessment. And I have all my equipment. I've got my stethoscope, my reflex hammer, and my pen light. And I have done my hand hygiene, and I've provided my patient with privacy. Closed the door, and I have done my patient's vitals. His vital signs are 128/68. His pulse is also 68, and his O2 is 98 at room air, and his temperature is 98.3, and his respirations are 18. So, hi, my name is Megan. I'm going to be doing a quick health assessment on you today. It takes about 15 minutes. Is now a good time?
Yep.
Okay, good. Can you tell me your name and date of birth?
David Mallory, 1984, January 1984.
Alright, good. Okay, can you tell me the date and where you're at?
It's June 5th, 2016, and I'm in Ocala Hospital.
Okay, good. Alright, so based off of our conversation, the patient is alert and orientated ×3, and he appears to have good hygiene, and also his posture is nice and straight. And he does not appear to have any lice or dandruff in his hair, so that is good. So I'm going to go ahead and get started. First, I'm going to start off on, just close your eyes for me, and just let me know where I am touching you on your face.
Go for it.
Okay, good. So that's a facial sensation, cranial nerve number 5. And now go ahead and puff your cheeks out and smile and open your mouth and say, Good. So facial movement of cranial nerve number 7 is intact. And now I'm going to check your ears out. So his left ear is clean, no excess cerumen, no lesions. And does it hurt when I pull on it? No. Alright, and this ear, the right ear, is also clear of cerumen and no discharge. And the external ear canal appears to be clean. And now I'm going to go ahead and I'm going to assess your pupils. So I'm going to flash this light in your eye real quick. Okay, good. So that's cranial nerve number 3, and your pupils are equal, round, and reactive towards light accommodation. And I'll just focus on the wall behind me. And good. All right, good. So now I'm going to have you follow my pin light with just your eyes and not with your head, okay? So extraocular eye movements are intact, which is cranial nerves 3, 4, and 6. And if you could just lean back a little bit. So nares are patent, no discharge, and septum is straight. And you can go back down. And now just open your mouth for me. And say, Okay, so uvula and tongue are midline, mucous membranes are pink and moist, and there are no apparent lesions. And his swallowing, I'll have you take a sip of water for me so I can assess your swallowing. Okay, good. So movement, swallowing, tongue, and uvula, so that's cranial nerves 9, 10, and 12. And now I am going to, can you hear that? Okay, so your hearing, which is cranial nerve 8, is also intact. So I'm going to go ahead and have you resist against my, okay? Here, good. And shoulder shrug, okay, good. So that is cranial nerve number 11. And now I am going to check out your lymph nodes, so you can just relax. So, submandible, submandibular, tonsils, postocular, preocular, occipital, postcervical, anterior cervical, and supraclavicular. So no lymph nodes are felt. Is nozzles of any kind. And now I'm going to have you hold your arms out for me and just resist me, pulling, good, and push, good, and pull, good, and push. Good. Okay, alright, and hold your hand out for me. I'm just gonna look at your capillary refill is less than 2 seconds on the left hand and less than 2 seconds on the right hand. I don't see any tenderness, redness, swelling, or edema of the left arm, and there is no tenderness, swelling, redness, or edema on the left arm. He does have tattoos, but other than that, he's clear. And I'm going to have you cover your eye, that eye, yeah. And can you see my fingers? Okay. 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 That eye. And can you see them? Okay. Good. Okay, good. So that is cranial nerve number 2 is intact. And I'm going to have you stand up for me real quick. Okay. And I'm going to just assess your movement. Put your arms behind you like that. You're good. And back. Good. And back of you. Good. Good. And do your hip rotation for me. And on that side. Okay, good. Alright, and I'm gonna have you, and just bend forward slightly. Okay, so the spinal area is straight, so there's no signs of kyphosis, lordosis, or scoliosis. Alright, you can have a seat again. Okay, and I'm gonna check your feet and everything. So capillary refill on the right foot is less than 2 seconds. There's no swelling, edema, redness, or tenderness. He does have a tattoo on his right leg, lower leg. And then capillary refill on his left foot is also less than 2 seconds, and he has no edema, redness, swelling, or tenderness that I see. So I'm going to do your reflexes real quick. So I'm going to start down here. And I'm going to do the Achilles colonus. Okay, good. And your patellar. Okay. And your patellar tendon reflex. Good. And your ankle colonus. Okay. And your. All right. So just hold your arm. Yep. And this is going to be your tricep reflex. Okay. And just relax. Good. Yep. Okay. And now your brachial radial. And just relax. And I'm going to do the same thing over here. Okay. And just relax. And your brachial radial. Okay, good. All right. So now I am going to listen to you breathe. So I'm going to start on your back and then I'm going to work my way around. Okay? This side, do the same thing over here. And here. Oh, no, I'm just going to listen to you breathe. It's pretty normal. so breath sounds or regular, and his depth is consistent. Cough for me. So no accessory muscles are being used. His thoracic area AP is 1 to 2. Alright, so this is going to be second intercostal space, right sternal border is the aortic valve. And second intercostal space, left sternal border is the pulmonic valve. And third intercostal space, fourth intercostal space, left sternal border is Erb's point. And fourth intercostal space, left sternal border is the tricuspid valve. And then the fifth intercostal space, midclavicular, is the mitral valve. Okay, so that sounds good. So heart sounds are excellent. So I'm gonna go ahead and I'm gonna have you lay down for me. I'm gonna watch your head. All right. So when was your last bowel movement?
This morning,
And did you last go pee?
like 30 minutes ago.
Okay, good. All right. And do you have any GI issues?
No.
And I don't see any pulsatile masses at all. So I'm gonna go ahead and I'm gonna listen to your bowel sounds. Everything's working in there. So I'm gonna start at the right upper quadrant and work my way around clockwise. Okay. So right upper quadrant, left lower or left upper quadrant, left lower quadrant, right lower quadrant. So now I'm going to go ahead and I'm going to palpitate lightly. If you have any discomfort or pain, just let me know. So right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant, and now I'm going to do deep palpitations. Right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Okay, so we are done, and I will leave you in here. This is your call button. If you need anything, you can just buzz us, but again, my name is Megan if you need anything, and you have a good day. It's nice meeting you.
You too.